All right, so get this. We're diving deep into healthcare consulting interviews today, and you've picked a pretty amazing career path.
Yeah, it's a really cool field.
It is, it is. Think of this deep dive as like your own personal cheat sheet to help you stand out, you know, from all the other people trying to get these jobs.
Definitely a competitive field for sure.
Okay, so you've shared some awesome resources from RoleCatcher, that career development platform, and they have a complete career guide and interview guide,
Yeah, really helpful stuff.
and even in info on how their AI can actually help you prep, which we'll get into later because that's super interesting.
It's the future of job hunting.
I know, right? But did you know a lot of companies are already using AI to scan resumes?
Oh, yeah, it's becoming pretty common, actually. It makes it feel like a lottery sometimes.
It does, it does. So
Yeah.
we have to be smart about how we present ourselves, right?
Yeah.
Like tailoring the resume to match the job skills. Otherwise, the AI might just toss it aside.
Exactly. That's where RoleCatcher comes in. They can help you beat the AI and get noticed by a real person.
Okay, but before we get to that, let's back up a bit. What exactly does a healthcare consultant do? Like, paint me a picture.
Okay, so imagine you're working with hospitals, clinics, government agencies, even pharmaceutical companies. You're basically there to analyze how they do things, find problems, and come up with solutions to make things better, improving efficiency, quality of care, ultimately making sure patients have better outcomes.
So it's not just about healthcare knowledge, it's about the business of healthcare too, right?
Exactly.
Okay, that makes sense. Now, the career guide has this whole section on pros and cons, which I thought was interesting. The pros are obvious, like high earning potential, making a difference, but some of the cons kind of surprised me.
Yeah, like what?
Well, it can be super high pressure, long hours, and sometimes you face these ethical dilemmas, like imagine having to recommend budget cuts that could impact patient care.
Oh, wow.
Tough, right? So it's definitely something to consider. Now, beyond healthcare knowledge, what LSC do you need to succeed?
Well, the guide highlights three main skills: speaking, learning strategies, and active listening.
Interesting. Why are those so important for a consultant, though?
Well, as a consultant, you're constantly presenting your findings, learning new information, and really listening to your clients' needs. You got to be on top of your communication game.
That's true. And you know what else I found interesting? The guide talks about knowledge domains like psychology and sociology, even philosophy and theology.
Really? Those seem a bit out there, don't they?
Yeah, at first. But think about it. These fields give you a deeper understanding of human behavior, decision-making, even ethical stuff. It's all relevant when you're dealing with the complexities of healthcare, right?
Yeah, I guess that makes sense. It's all connected.
Okay, let's talk about the career path itself. The guide outlines four main stages: entry-level, junior, mid-level, and senior.
Right. So at the entry level, you're mainly focused on research, data analysis, and supporting those senior consultants. As you move up, you take on more responsibility, managing projects, leading teams, and eventually you're advising those high-level executives.
And they actually have these example profiles for each stage, which I found really helpful to visualize the progression. But let's be real, the part you're probably most eager to dive into is how to nail that interview right.
Absolutely. That's what I'm here for. I need to know how to impress these people.
Okay, well, the interview guide's got your back. It's got all these tips and strategies, and it all starts with understanding what the interviewer is really looking for. Like, what are they actually trying to figure out about you?
Okay, that makes sense. Get in their heads, right?
Exactly. So let's jump into some common questions, break them down, share insights from the guide, and even give you some sample responses you can use to craft your own winning answers. First up, what experience do you have in the healthcare industry? Seems simple, but it's not just about listing jobs.
Right. What are they really getting at?
They want to see your understanding of the healthcare landscape, its challenges, the key players. How deep does your knowledge go?
Okay, so what if my experience isn't directly in healthcare consulting? How do I spin that?
Highlight those transferable skills. Think about any experience where you've shown analytical skills, problem solving, even just a genuine interest in healthcare, like volunteering at a hospital, interning at a clinic, or even a project involving research or data analysis, anything that connects to the consultant role. And whatever you do, don't just say, I have no experience.
Right, right. Definitely don't want to do that.
Instead, reframe it. Focus on what you have done and how that's prepared you for this challenge.
Okay, so let's say I have experience with data analysis, but for a nonprofit focused on public health. How can I use that?
Perfect example. You could say something like, while my direct experience is in data analysis for a public health nonprofit, This role gave me a deep understanding of the challenges facing underserved communities. I analyzed data on healthcare access, identified trends, and helped develop programs to address these issues. This experience has given me a strong foundation in data-driven decision-making and fueled my passion for improving healthcare outcomes.
Wow, that's actually really good. I can see how that would impress them.
It highlights relevant skills, connects them to healthcare, and shows that you're passionate about the field. And you know what? This is where RoleCatcher's AI comes in. It can analyze your experience and the job description to help you tailor your response even further.
So it's like having a personal resume writer.
Kind of, yeah. Make sure you're highlighting the most relevant stuff. Okay, let's move to the next question. How do you stay up to date with industry trends and changes?
Oh, good one.
This one's all about showing your dedication to continuous learning, that you're not just stuck in the past.
So I can't just say I read industry publications. Got to be more specific.
Exactly. Name those publications,
Yeah.
mention conferences you've attended, professional organizations you belong to, even healthcare thought leaders you follow on social media, anything that shows you're actively engaged. And definitely don't say you don't really stay updated or just rely on your old job for information. That's a red flag.
It makes you sound out of touch, yeah.
Okay, let's say I'm really into healthcare technology and follow all the latest developments. How could I work that in?
Okay, I'm listening.
You could say, I'm fascinated by how technology is changing healthcare delivery. So I regularly read publications like Healthcare IT News and the Journal of Up Health. I also go to industry conferences like HIMSS and follow thought leaders on social media to stay informed on the latest in telehealth, AI, and data analytics.
That's pretty good. Specific and shows I'm actually interested.
Exactly. And RoleCatcher's AI can analyze your response, suggest ways to make it even stronger, and make sure you're using the right industry keywords. Okay, next up. What do you think are the biggest challenges facing the healthcare industry currently?
Okay, that one's a bit broader. What are they looking for here?
They want to see your understanding of the healthcare landscape, your critical thinking skills, how you connect your knowledge to the real world. So it's not just about listing challenges, it's about understanding their impact.
Got it. So it's about analysis.
Exactly. Focus on issues relevant to the specific role or organization you're interviewing for.
So, like, if I'm interviewing for a role focused on improving rural healthcare, what could I say?
You could say something like, one of the biggest challenges, especially in rural areas, is the shortage of healthcare professionals. This is made worse by limited access to specialists, transportation issues, and lack of funding for rural healthcare facilities. These issues lead to disparities in healthcare access and outcomes for rural populations.
That sounds really good. It shows I actually understand the issue.
Exactly. And RoleCatcher's AI can help you research and identify the most relevant challenges for the specific job, making sure your answer is on point. All right, next. What is your approach to problem solving? This one seems simple, but there's a lot to unpack.
Oh, yeah, definitely.
They're looking for evidence of your analytical skills, your ability to think systematically, to tackle complex issues.
So walk them through my method step by step.
Exactly. How do you define the problem? What kind of info do you gather? How do you analyze it and come up with solutions? Showcase that thought process. And don't make it sound like you never encounter problems or have all the answers. Humility goes a long way.
Makes sense. So be honest, but show you can handle it.
Right. Now, let's say your background is in research and you're used to a very data-driven approach. How would you structure your response?
Okay, let me think.
You could say, my problem-solving approach comes from my research background. I start by defining the problem clearly and gathering all the relevant data. Then I analyze this data to find trends and potential root causes. Next, I brainstorm solutions, evaluating each one based on feasibility, cost-effectiveness, and potential impact. Finally, I implement the chosen solution and continuously monitor its effectiveness, making adjustments as needed.
That's a great response. I can see how that showcases my process.
And RoleCatcher can actually help you tailor this even further. They have this library of problem-solving frameworks and methodologies, so you can find one that matches your style and the specific job.
It's like they thought of everything.
I know, right? Okay, next question. What is your experience with project management? Super relevant for consultant roles.
Definitely. Juggling projects is part of the job description, right?
Absolutely. They want to see your organizational skills, your ability to manage time, and your experience leading and collaborating with teams.
Okay, but what if I haven't had a formal project management role?
Think about any experience where you had to plan, organize, and execute something, even outside of work, leading a volunteer project, organizing a fundraiser, even planning a big event. The key is to focus on the skills you used. Setting deadlines, delegating tasks, monitoring progress, communicating with stakeholders.
So reframe it to highlight those skills. Don't downplay my experience.
Exactly. Let's craft a response for someone who planned and executed a large-scale community health initiative.
All right, shoot.
They could say, while I haven't had a formal project management title, I played a key role in planning and executing a large-scale community health initiative. This involved coordinating with multiple stakeholders, setting timelines, managing a budget, and overseeing a team of volunteers. Through this experience, I gained valuable skills in communication, delegation, and problem solving, all essential for effective project management.
That's a great example. Shows I can handle complex projects.
Right. And RoleCatcher's AI can identify the most relevant project management keywords to make your answer even stronger. Okay, communication is key in any role, but especially consulting. So let's talk about this question. Can you discuss a time when you had to communicate difficult or complex information to a client or colleague?
Ooh, this one sounds tricky.
It is. They want to know how you approach challenging conversations, ensure clarity, and handle pushback or disagreement.
So it's not just about being a good speaker, it's about being a good communicator, even when things get tough.
Exactly. The guide emphasizes storytelling here. Choose a specific situation where you had to convey tough information, set the scene, describe the challenge, and walk them through your process. How did you prepare? What strategies did you use to ensure clarity? How did you handle their reaction?
Okay, makes sense. So don't choose an example where I didn't communicate well or where I avoided the conversation altogether.
Right. Highlight your strengths. Okay, let's say you had to deliver bad news about a project delay. How would you structure your response?
Okay, let me think about that.
You could say something like, in a previous project, I had to tell a client about an unexpected delay. This was tough because it impacted their timeline and budget. I first prepared by gathering all the info and anticipating their questions and concerns. Then I scheduled a face-to-face meeting, explained the situation clearly and honestly, and presented a revised timeline with clear milestones. I also emphasized my commitment to finding solutions and keeping them updated. While the initial conversation was difficult, my transparent and proactive approach helped maintain trust and led to a positive outcome.
That's really good. It shows I can handle difficult situations professionally.
And RoleCatcher can analyze your response, ensuring your language and tone are perfect for healthcare consulting. Okay, one more question before we wrap up this part. How do you manage competing priorities and deadlines? Consultants are always juggling multiple things.
Sure, that's a real skill.
What they're really assessing is how you prioritize, how you handle pressure, how you make sure nothing slips through the cracks.
Got it. So, organization and staying calm under pressure.
Exactly. Share your specific strategies. Do you use to-do lists? A project management app? Do you color code your calendar? Be detailed and specific. Show you have a system. And don't say you just wing it or that you miss deadlines often. Project an image of competence and control.
Got it. So I'm organized and use a combo of digital tools and good old-fashioned lists. How could I answer this?
Perfect. You could say something like, I'm a big believer in having a system for managing my time and workload. I use a combination of digital tools like Trello for project management and Google Calendar for scheduling. I also keep a detailed to-do list, prioritizing tasks each day. This helps me visualize my commitments, allocate time effectively, and ensure I meet all deadlines.
That sounds really organized and on top of things. I like it.
And RoleCatcher's AI can help you highlight the specific tools and strategies that resonate with healthcare consulting hiring managers. This has been such an informative deep dive into healthcare consulting interviews.
It really has. I feel much more prepared now. Welcome back to our deep dive.
Okay, so we're picking up right where we left off.
More interview questions.
Yeah, giving you the knowledge and strategies to, really impress in those interviews.
How to make a good impression.
Exactly. Last time, we talked about those foundational questions. Your experience, how you stay updated, problem solving.
Right, the basics.
Yeah, and we even touched on communicating tough info and juggling multiple projects.
Those were tricky.
They were. But remember, it's all about showcasing your skills, showing that passion for making a real difference in healthcare.
Right, gotta show them you care.
Now let's get into some more specialized questions. These really get to the heart of what it takes to be a great healthcare consultant.
Okay, bring it on.
First up, how do you approach developing a healthcare improvement plan for a client? This one sounds like it requires a strategic mindset.
It does, yeah. Lots of moving parts in healthcare.
Exactly. And a deep understanding of those complex systems.
So what are they really looking for with this question?
They want to see if you could think systematically, analyze the situation, pinpoint the key issues, and then create that roadmap for improvement.
It's like asking for a mini blueprint.
Pretty much.
Yeah.
RoleCatcher's interview guide breaks it down into steps.
Okay, that's helpful. Lay it on me.
First, you emphasize understanding the client's needs and goals. What are their pain points? What are they trying to achieve?
Right, so it starts with the client.
Always.
Yeah.
Then, you talk about data collection and analysis. What info would you gather to get a clear picture? What metrics would you track?
Data-driven approach, just like we discussed before.
Exactly. Data is key in healthcare consulting.
Yeah.
Once you've analyzed that data, then you move on to identifying those areas for improvement, developing those specific recommendations.
So it's not enough to just point out problems, you have to offer solutions.
Exactly. And of course, implementation is super important. A plan's only as good as its execution.
Right. Got to be able to put it into action.
So you want to highlight your ability to create plans that can actually be implemented, not just theoretical stuff. Talk about involving the client, measuring progress, adapting the plan as needed.
Okay, makes sense. So it's a whole process, not just a quick fix.
Definitely. What should you avoid saying when answering this question?
Good question.
Don't make it sound like you have a one-size-fits-all solution or that you can solve everything overnight. Healthcare is complex and improvement takes time.
Right, it's a marathon, not a sprint.
Exactly. So be realistic, show you understand the challenges. Now, let's say you're interviewing for a role focused on improving patient satisfaction. How would you tailor your response?
Okay, let's see.
You could say something like, my approach to developing a patient satisfaction improvement plan would start with gathering data from multiple sources, like patient surveys, staff interviews, industry benchmarks. I'd analyze that data to identify key areas for improvement, like wait times, communication breakdowns, or a lack of personalized care. Then, based on those findings, I'd work with the client to develop and implement specific solutions, like process improvements, staff training, or even technology enhancements. And I'd establish clear metrics to track progress and ensure we're achieving those desired outcomes.
Wow, that's a really comprehensive answer.
It's clear, structured, data-driven, and it really emphasizes collaboration and measurable results. And remember, RoleCatcher can help you tailor your responses even further. Their AI can analyze the job description and suggest keywords, phrases, even examples.
It's like having a personal interview coach.
I know. Okay, moving on to another important question. How do you ensure that your recommendations align with a client's goals and values? This goes beyond just finding any solution.
Right, it has to be the right fit for them.
Exactly. They want to know if you're not just a problem solver, but a good listener and collaborator. Do you get that healthcare isn't just numbers and metrics, but people, values, relationships?
Right, the human side of things.
Can you tailor your recommendations to fit that client's unique culture and context?
Okay, so how do I demonstrate that I'm tuned in to those needs and values?
Talk about your process. How do you get to know your clients? Do you conduct stakeholder interviews? Review their mission statement? Ask about their culture and priorities. Observe their interactions.
So it's about showing that I'm genuinely trying to understand their perspective.
Exactly. And don't forget to mention how you factor in budget constraints, operational realities, and any regulatory or ethical considerations.
Right, the practical side of things.
It's all about finding solutions that are both effective and feasible. Let's say you're interviewing at a community health center that serves low-income families. How would you tailor your answer?
Okay, this is a good one.
You could say, when working with a community health center like this, I'd prioritize understanding the unique needs of their patient population. I'd learn about the barriers they face in accessing healthcare, the social determinants of health that impact their well-being, and any cultural considerations. I'd also work closely with the staff to understand their workflow, their resources, and their capacity for change. This approach ensures my recommendations are evidence-based, culturally sensitive, financially feasible, and aligned with the center's mission to provide equitable and accessible healthcare.
That's really thoughtful. It shows you care about the community.
And RoleCatcher's AI can help you research the specific organization, tailor your response even further.
They really do have everything covered.
I know. Okay, let's shift gears a bit. Tell me about a time you failed. This one can throw people off.
Oh, I hate this question.
I know, right? But it's a chance to showcase resilience, self-awareness, growth mindset.
So they're not trying to make me feel bad.
No. They want to see how you handle setbacks, learn from mistakes, bounce back from adversity.
Okay, so it's about how you deal with failure.
Exactly. Choose a specific example. Don't be vague or downplay your role.
Okay, so own it.
But how do I talk about it without looking incompetent?
Focus on the lessons learned. What went wrong? Why? What did you do to fix it? What would you do differently next time? It's not about dwelling on the negative, it's about showing growth.
And avoid blaming others or making excuses.
Right, take responsibility.
But let's say you had a project that didn't go as planned. How would you answer?
Let me think.
You could say, in a previous project, I underestimated the complexity of the client's data systems. This caused delays in our analysis and impacted our ability to deliver recommendations on time. I realized I hadn't properly assessed the data integration process and hadn't communicated effectively with the client's IT team. To fix it, I brought in additional resources and worked closely with IT to streamline the data transfer. I also revised the project timeline and kept the client informed every step of the way. Although the project was ultimately successful, I learned a valuable lesson about planning, communication, and managing expectations. Now, I always assess data systems early on and establish clear communication with everyone.
That's a great example. You owned the mistake, but showed how you learned from it.
Exactly. And RoleCatcher's AI can provide feedback on your response, making your story even more compelling and impactful. Okay, another tough one. What are your strengths and weaknesses?
Ugh, this question always feels like a trap.
It can, but it's a chance to show self-awareness and your commitment to continuous improvement. When talking about strengths, be specific, provide examples, and make sure they're relevant to healthcare consulting.
Okay, so show them I can actually back it up.
Right. And when discussing weaknesses, be honest but strategic. Choose a weakness you're actively trying to improve and give examples of the steps you're taking.
So they see that I'm self-aware and working on myself.
Exactly. Let's say your weakness is public speaking. How would you frame that?
Okay, good example.
You could say something like, while public speaking isn't my natural strength, I know it's important in healthcare consulting. To improve, I've been taking a public speaking course and looking for opportunities to present my work to colleagues and stakeholders. I've also been working on managing my nerves and projecting confidence. I'm seeing progress, and I'm committed to continuing to develop this skill.
That's a good way to put it. Shows you're taking action.
And again, RoleCatcher's AI can analyze your response, making sure your strengths and weaknesses align with the job requirements. Okay, one last question. Why are you interested in healthcare consulting? Seems simple, but it's a chance to shine.
Right. Gotta make them feel my passion.
They want to see you're genuinely interested and that you understand the field.
So how I answer authentically and make it interesting?
Start by reflecting on your personal journey. What sparked your interest in healthcare? What draws you to consulting? Any personal connections or passions within healthcare?
Okay, make it personal.
And mention why you're interested in this specific company. Show you've done your research.
Okay, let's say I'm passionate about using data to improve patient outcomes. What could I say?
You could say, my interest in healthcare consulting stems from my passion for using data to make a real difference in people's lives. I've always been fascinated by how data can identify trends, reveal insights, and drive positive change. Healthcare consulting allows me to combine my analytical skills with my desire to improve patient outcomes. I'm excited by the opportunity to work with healthcare organizations to leverage data, improve efficiency, enhance quality of care, and ultimately create a healthier future.
That's a really strong answer. It's personal, passionate, and it gets the point across.
And remember, RoleCatcher can help you fine-tune it, make sure it resonates with the company and role. It's all about doing your authentic self and showing your genuine interest. This has been such an insightful look at those healthcare consulting interview questions.
I feel so much more prepared now.
Okay, so we're back for the final part of our deep dive.
Time to wrap things up.
We've talked about the role, those tough interview questions, strategies for showcasing your skills.
It's been a lot of info.
It has. But now, let's talk about RoleCatcher and how it can give you a real edge.
Yeah, let's get into that.
Remember how we talked about AI in recruiting? It's everywhere now.
It can be kind of scary, honestly.
I know. Companies use algorithms to scan resumes, filter candidates. It makes the whole process feel impersonal.
Yeah, like you're just a number.
That's where RoleCatcher comes in. They actually use AI to help you understand those algorithms, so you can optimize your resume and get noticed by a human.
So it's like fighting fire with fire.
Kinda, yeah. They analyze job descriptions and give you personalized feedback on your resume, showing you how to improve your score and increase your chances of getting shortlisted.
That's amazing, like having a secret weapon.
It is. And they even have a feature that helps tailor your resume to specific companies, making sure your skills and experience align with their values and priorities.
So it's not just a generic resume blast. You can really target it.
Exactly. But RoleCatcher goes beyond resumes. They have this awesome interview practice tool that uses AI to give you feedback.
Oh, wow. Tell me more.
You record yourself answering common interview questions, and their AI analyzes everything: your delivery, content, even your body language.
No way. That's so cool.
It's like having your own personal interview coach, giving you insights and suggestions to help you sound more confident and polished. They even have a feature that analyzes your responses for specific job roles.
So it's tailored to what those hiring managers are looking for in healthcare consulting.
Exactly. But remember, while RoleCatcher is a powerful tool, it's not magic.
Right, you still have to do the work.
Your preparation, your enthusiasm, that genuine passion for healthcare, that's what's really going to make you stand out.
It's about the whole package.
Exactly. Use RoleCatcher to refine your materials, practice your skills, but let your authentic self shine through. Show those interviewers you're not just looking for any job, you're looking to make a real difference in healthcare. And that's a wrap on our healthcare consulting interview deep dive.
Wow, what a journey.
I know, right? We covered a lot. But remember, you've chosen a challenging but incredibly rewarding career path.
Definitely something to be proud of.
With the right preparation, the right tools, and the right mindset, you can achieve anything. So go out there, ace those interviews, and start making that impact in healthcare consulting. We're cheering you on.
Thanks for all the great advice. I feel so much more prepared now.